Hi, this is Dr. Nagy. We have received a few questions about dental and orthodontic emergencies, so I thought I could go through a couple of different options that may help you. Some of the most common questions that we have is actually about orthodontic emergencies, especially when you have like a low ligature tie or a wire poking. Ligature ties are basically the little ties around the brackets. They're really small, and sometimes if they come unraveled, they'll kind of poke your cheeks. So that's fairly easy to fix. And the other common issue is maybe the wire behind the molars poking a little bit, or you may have a bracket that's loose. Okay, so if you have one of those low ligature ties poking around the bracket, what you can do is you can take one of these simple pencils with the pencil eraser, and then you can simply place the eraser on that low ligature tie and just push on it and kind of just gently tuck it in and kind of feel it with your cheek or your finger and make sure that's not poking anymore. So it's fairly simple to take care of with this little pencil like this with the pencil eraser. The other thing that you can do is you can get like a nail clipper, and you can clip it if it's maybe too long or if it's still poking and you can't tuck it in with the eraser. Try the eraser first, and if that doesn't work, you can maybe try to get a little nail clipper and clip it short, and you can always give us a call and then we'll take care of it as soon as we can see you in the office. If you have a bracket that's loose, loose brackets usually don't cause much discomfort. You can just ignore it until you can get in an office, and then we can re-cement it. Okay. The other option is if you have like something poking, you get some wax in our office, or you can pick some up at our office, and then you can put some wax around the bracket or the wire that's poking you. If you have a wire that's poking behind the band, the best way to take care of that is if you come to our office and we clip it, or we can cut that wire kind of sticking out there. If you can, if it's really poking you, then what I would suggest is maybe put some wax around it, some of those sticky wax, and then just keep that there, replace it as you eat, and then when you come in the office, we'll cut that. Sometimes if you can get to it with the nail clipper, you can clip it too, but sometimes it's hard to get to these bands in the very back. Okay, so those are the most common orthodontic emergencies really, and then usually you can take care of this fairly easily with, like I said, if it's a wire, just with a simple pencil and eraser. Give us a call. We also have a teledentistry app that we can do like a FaceTime session and maybe walk you through it. Our office numbers is on the internet, as well as I'll post it here, so you're welcome to call us anytime. But those are the most common emergencies that we see with patients who are in braces. Okay, a couple of other questions that we often get is canker sores, aphthous ulcer. Aphthous ulcer, it's like an autoimmune reaction. Common name is canker sores, and the best thing you can do with that is not to rinse with anything real strong alcohol-based mouth rinse, but use more like salt water rinse. The other thing you can do is make like a chamomile tea and with some salt in it, and then rinse with that, and that will help keep it clean and heal. Aphthous ulcers or canker sores, they can be quite sore, and they'll take probably 7 to 10 days to heal. So the biggest thing is to make sure keep it clean, and like I said, don't rinse with anything that's really high alcohol based, because that would actually prevent it from healing. Try to rinse with more like a salt water, or maybe a chamomile tea and salt in it, that kind of solution, and that will keep it nice and clean and help it to heal. You can also use peroxyl. It's not peroxide, but peroxyl. It's designed for intraoral use. That also helps to keep it clean. It's called peroxyl. You can buy it at the store over the counter. And again, it's not peroxide. That's more for like wound cleaning. It's called peroxyl, and it's made for intraoral use. So you can try that. And the third most common emergency that we see is actually dry sockets. If you had an extraction recently at an oral surgeon's office or our office, normally you get a blood cloth in the socket, and that blood cloth eventually heals and becomes like a bony tissue, and the gum tissue heals over it, and everything looks good after a few days or a week. If you lose that blood cloth early, or it dissolves early, or it never forms, what happens, you end up with this area that has like a localized localized infection. Sometimes it's called dry socket, and it can be pretty sore, and it takes a while to heal. So always give us a call, or give the oral surgeon a call where you had the tooth extracted. But in some cases you need an antibiotic for dry sockets. Other cases you just have to keep it clean. Again, with dry sockets, the best is not to use like a really strong alcohol-based mouth rinse, but use more like a salt water based solution, or maybe chamomile tea with some salt in it, and keep it dry and keep it clean. If it's really sore, make sure to give us a call, and then we'll get you in and take care of it. And again, don't forget, if you call us, we might be able to do like after-hour session with our teledentistry app, where we can take a look and maybe help you until you can get back in the office. So those are the most common emergency questions that we get. If you have any questions, you're always welcome to give us a call or email us, and we're here to help you. And enjoy the rest of the week, and thank you for watching. Bye.